Hi everyone, welcome to my channel. The topic today is pneumonia must know. So welcome to this high yield pneumonia review designed specially for NP exams and board preparation. And this video will cover definitions, pathogens, diagnosis, treatment, and exam traps you are very likely to see on the exam and also in practice. Let's talk about pneumonia. What is pneumonia? Pneumonia is an acute infection of the lung parenchyma, not just the bronchi. So on exams, remember that inflammation leads to alveolar filling with fluid or pus, causing consolidation and impaired gas exchange. There are different types of pneumonia. Classification matters because it determines likely pathogens and antibiotic choice. The community acquired pneumonia is the most tested on NP exams, but also you have the aspiration, the atypical. But you need to remember hospital acquired pneumonia and ventilator associated pneumonia, they involve more resistant organisms. Now, let's talk about the pathogens. Strep pneumoniae is the #1 cause of community-acquired pneumonia and a frequent exam answer. Atypical pathogens usually present with milder symptoms and require coverage with macrolides or doxycycline. It is very important to know the classic symptoms of pneumonia. Classic symptoms include fever, productive cough, shortness of breath. In older adults, remember, confusion may be the primary or only symptom. This is a common exam trap. Make sure you don't miss that question. Crackles are the most common finding. Egophony and dullness suggest consolidation and help distinguish pneumonia from bronchitis. One important thing for you to remember on this slide, a chest x-ray is required to confirm pneumonia. You also need to become familiar with the curve 65. This helps determine outpatient versus inpatient treatment. Scores of 0 to 1 are usually treated outpatient, while higher scores suggest hospitalization. Now, let's talk about treatment plans. Healthy patients without comorbidities, they can be treated with amoxicillin or doxycycline. But macrolides, they are only appropriate if local pneumococcal resistance is low. So you need to remember that. Amoxicillin, doxycycline for healthy patients without comorbidities. Now, you really need to know this. Patients with chronic disease, they need broader coverage. Combination therapy or a respiratory fluoroquinolone is recommended. So when treating pneumonia, you need to remember 5 days is the minimum duration, okay? So make sure that your patient is clinically stable. Now, let's talk about prevention. Vaccination is a major prevention strategy. Make sure you know current pneumonia vaccine recommendations for older adults 65 and above and high-risk patients. I have the link of the CDC on this slide. Make sure you check it out because sometimes the information will be updated so you can stay up to date. It is important for you to know that untreated or severe pneumonia can progress to life-threatening complications such as sepsis. Make sure you recognize these signs early and you treat pneumonia as soon as possible. Now let's talk about some exam traps. Exam questions often test what you forgot to do, like ordering a chest x-ray or addressing vaccination status. So make sure you remember that. Chest x-ray, make sure you choose the correct antibiotic for your patients with or without any comorbidities. If you remember nothing else, remember this. Community-acquired pneumonia is extremely high yield. Always confirm with chest x-ray and tailor antibiotics to patient risk factors. You made it to this slide, so now let's do a quick Q&A. A 72-year-old woman presents to the clinic with confusion, generalized weakness for 2 days. Her daughter reports no fever or cough. Past medical history includes COPD and type 2 diabetes. We have the vital signs: low blood pressure, high heart rate, respiratory rate is high as well, and SpO2 90% on room air. Physical exam reveals crackles in the right lower lung field and dullness to percussion. What is the most appropriate next step and management? We have the answer choices A, B, C, or D. So the correct answer is C. You need to obtain chest x-ray and admit for IV antibiotic. The reason why: the 72-year-old patient has high-risk features concerning for community-acquired pneumonia with severe illness. Even though she lacks classic symptoms like fever or cough, some key exam clues: the patient is older, so this is an atypical presentation, confusion, and weakness. The lung exam: crackles and dullness to percussion, and the vital signs. So the comorbidities: COPD, diabetes. So the patient is critical. So if you apply the curve 65, confusion, heart rate is concerning, the blood pressure is concerning as well, and the patient is older than 65. So she scores at least 2, which indicates hospital admission. Thank you so much for watching this video. I will upload another one next Wednesday. We'll talk about another topic. Make sure to subscribe and also give this video a thumbs up if you enjoyed the content. Thank you.